In our changing world, there's a real need to access virtual healthcare. And today at Sun Life, we're leading the industry with virtual care innovations. Lumino Health Virtual Care, powered by Dialogue, lets employees and their family members connect with healthcare professionals online and receive a diagnosis and treatment for physical or mental health concerns. Online cognitive behavioral therapy and virtual paramedical services also provide effective treatment from the comfort of home, eliminating travel, reducing wait times, and helping Canadians get back to feeling their best faster. Learn more about Sun Life's virtual healthcare solutions.
So let's start with the elephant in the room, which is COVID-19. So it's upended, the economy pretty much in every sector you can think of in a way that none of us have seen in our lifetime. So Frank, I'm going to start out with you, if you don't mind today, to kind of look at what are some of the issues facing small employers and how have benefit plan providers kind of responded to this pandemic?
Sure. Thanks, Todd. Yeah, everyone, I think we can actually say everyone's been impacted by COVID-19, and it's really created unprecedented socioeconomic and health challenges for both employers, business owners, and their employees. And we're really living through very challenging times because it's not only a question of having employees in lockdown, which was, something that really we haven't seen on such a large scale like that. But now as lockdowns ease, even though we have a threat of a second wave, but as they ease, it's really merging sort of that work between being able to go back with all the restrictions that the government are putting in place. You have a lot of employees that have to juggle not only their work responsibilities, but also maybe caring for a loved one and kids going back to school. So you really have a lot of challenges going on at the same time. And for small business owners, I mean, a lot of them are, wear multiple hats, right? So they're the business owners. Sometimes they're a little bit of the HR person. They're in charge of marketing and sales. So they're really involved quite a bit. So their focus has really been on keeping the doors open, but also managing and really responding to all the challenges that their employees are facing. So as an insurer, it was really all about providing just-in-time support for our plan sponsors and our clients. And a couple of things that we did to approach that on the financial side, for example, is really providing some financial relief. So we looked at, flexible premium payment options. Can we defer payments by a little bit just to help them out and cash flow? We also provided premium credits. So because of a lot of the lockdowns, a lot of services that employees would typically use, such as from dental service providers or paramedical services, they weren't being offered. So those credits, or if you will, those claims were actually funneled back to plan sponsors as premium credits. So that's the financial component. We also look at easing some of the administrative services. So for example, employees that were, in lockdown back at home, but employers that wanted to keep up their benefits, we were able to extend a lot of the benefits for these folks, even though the employees were on reduced hours or in some cases, not working at all. So really it was providing a lot of support for clients, for the advisors, and really helping them manage through this period. And it was really important to adapt very quickly. So what we did is we also created a website really specific for COVID-19 for both our sponsors and advisors, because information was, especially at the beginning, I think back in March and April, information was really coming fast and furious and changing quite rapidly. So we wanted to create really a resource center for folks to be able to really get that information just in time, but also very specific to their province or their territory.
Great. Patrick, what are your thoughts on COVID-19 and what it's done to organizations?
Well, I think first of all, the insurance companies reacted very well to COVID-19. I think we were all in the same situation where we didn't know what the future held. So you were it was changing every week, every 2 weeks, and because the insurance company were receptive, because all this was not covered in contracts, the written contracts we had with our clients. We had to go outside the box and think about how we could answer their needs. Some decided, some really didn't have any money to continue paying premiums, so they just suspended their benefits for a month or 2 months, 3 months, and were allowed to get them going again without any penalties or anything. Some took more than 60, 90 days to pay us. Okay, so I think it was it showed the community came together to answer the call. Uh, it was a weird time to live through. Now, if there is a second wave, there probably is going to be one. It's going to be easier because we know what we're facing to a certain extent. But in March and April, it was fast and furious, and the governments were changing their plans. The insurance companies had to adapt. We had to adapt. And for a certain period of time, the employers were a little in the dark, wondering what they were going to do with their employees. And so it's nice to see that we all came together and we got through it.
And Dominica, what about you? What have you seen related to the pandemic play out?
So we actually were in a very interesting position because even though we were in lockdown, none of our work really slowed down. And as soon as some of the restrictions were being lifted, we hired a great number of employees. So we experienced the pandemic from a different perspective, where we had to onboard people without actually having all of the answers, and hope that everything worked out. So even though it's a huge struggle, and there were a lot of people who didn't quite know exactly what was happening, having the support from our benefits providers really helped us, because we were able to provide our employees with at least some answers and let them know that they would have coverage.